they will see 40, 50, 60 patients in a day. That for these busy practices with a lot of doctors, that is very normal. They don't have time. They don't have time to talk to you. They don't have time to really understand what's going on. And they don't have time to go learn about the drugs. They rely on the drug reps to come in and give them the studies, the information. And what they're really interested in is knowing whether or not the patient can afford it, if the efficacy was good, or what are the common side effects, because they don't want to get a bunch of calls from patients complaining. So that's pretty much how the model works. And then over time, they call it real world data. Once a drug has been out long enough, then you start to understand, like, oh, well, now that enough people have been on it, we are starting to see that in actuality, this is a side effect, you see? And so there are some doctors that are old school. They only like using old school drugs because they know that those drugs are tested and true. They work, they have minimal side effects, so they get comfortable with that because they don't want all the calls from the patients that are feeling the symptoms. So to finish my point, Catherine, I would say that if there is a bunch of other people that are also getting hair loss while they're on that drug, then they'll end up saying like, oh yeah, there is a correlation.